An Ontario doctor is walking away from the province's COVID-19 advisory table, claiming data is being held back and the group is too close to political motives. In his resignation letter, Dr. David Fisman alleges the modeling data is showing a grim fall. Jason Gaidola reports.
Dr. David Fisman says he's quitting the province's COVID-19 advisory table over his belief that the group lacks independence from politics and alleges the table is sitting on data. He took his resignation letter penned to Dr. Adelstein Brown to Twitter, adding he doesn't want to be in an uncomfortable position where I must use placid relations with colleagues on one hand and the necessity of speaking truth during a public health crisis on the other. This following when the epidemiologist from the University of Toronto claimed modeling data is projecting a grim fall.
So he's going out on a limb. There's been politics influencing the government's decisions all along through the pandemic, and that's kind of how it works.
The advisory table fired back on social media, calling the allegations untrue, and they are currently beginning to generate single models for review.
Now, they haven't released any modeling since June, so we are due for some. He has a point. We should see some new modeling, but and it's a big but. Where's the others that are expressing the same concerns?
The advisory table has yet to say when new modeling will be released, and with school just around the corner, Leslie says the Ford government need to reveal safety plans and vaccine mandates to the public.
I think it's going to be a difficult fall and winter.
With the Delta variant making up nearly all COVID-19 cases, Ontario's top doctor is anticipating a rise.
That might not be that far off from what we saw in wave 3, where it got to the highest, right?
Infectious disease specialist Zane Chagla says unvaccinated people are making up majority of the daily cases. And with it being more transmissible among that group, hospital capacity is at risk.
The timelines are looking good for the Pfizer vaccine to start getting given to children and the data to come out in there. But we have a few months where that's not going to be the case.
According to the province, 3/4 of people who are 12 and up in Ontario are fully inoculated. Niagara's Chief Medical Officer, Dr. Mustafa Hirji, says protecting students when they head back to class is key this fall. And unless jabs get approved for younger children, herd immunity is not possible.
We need to get vaccinations up to the order of like 97, 98% to actually get herd immunity. So herd immunity, I think, is out of reach at this point, at least from vaccinations alone.
Jason Gaidola, CHCH News.